It's going to be a challenge. I mean, the advent of these newer therapies is witnessing very long progression-free survivals with therapies that are fairly easily administered orally. I do think that what we're going to do is we have to understand that the incidence of CLL is not increasing. Some have argued that it may be, but if we have better therapies, there's going to be a larger and larger prevalence of patients who have this disease as they're surviving better. And sometimes cancer is like whack-a-mole in that it always finds a way to grow back, and we have to be attentive to what defines resistance to some of these newer treatments. It's clear that we have mechanisms of resistance to a drug such as ibrutinib, but now more and more we're seeing resistance to a drug such as venetoclax. And there are many groups, including our own, that are working on what defines the resistant subclone that allows it to survive therapy with venetoclax, either alone or in combination with monoclonal antibodies or other drugs, and what also drives the progression of that disease. So I think the next advance is going to be trying to address those areas of unmet medical need of patients who are feeling some of these exciting new treatments, and I think there's still more work to be done.